Hi, let's revise the Modified Maastritch Classification of organ donors, especially relevant in the context of organ transplantation. So basically, this is done for donors after circulatory death, which would be referred to as DCD now on. Here we need to know the categories 1 through 5. Which of these is a situation that's controlled or uncontrolled? Here we need to know the presentation of death or the presentation of the donor patient in one of these 5 categories, and also which kind of organ we can procure from the said donor. Let's understand this table in an easier manner. So as we just saw, the donors, the DCDs, are classified into 2 umbrella categories, which are the uncontrolled death or the controlled circulatory death donors. The 5 categories that we are going to discuss are 1 and 2 were in uncontrolled category, 3 and 4 were in the control category, and the 5th one was again the uncontrolled type of donor. So the first category was dead on arrival. So the patient was already dead, and once they came to the hospital, they were declared to be dead. The second category is unsuccessful resuscitation. This is further divided into 2, which are that the unsuccessful resuscitation happened outside of the hospital, and the second one is that the patient was already admitted and then they underwent a cardiac arrest and resuscitation was tried upon them, but it ultimately failed. Third category on the controlled side is that the patient is awaiting, or the cardiac arrest is basically anticipated. These are the patients in whom the life sustaining treatment is withdrawn and you're expecting death. For example, this is a patient who is on ventilation. They have severe brain injury, but they're not brain dead. They've also signed an NDR where you're not going to try resuscitating them. So a trial of resuscitation won't happen in a category 3 patient. Now category 4 patient is basically cardiac arrest in a brain dead donor. Here the patient has already been declared brain dead, but before organ retrieval they have experienced a cardiac arrest. The category 5 is that the patient was hospitalized. They have experienced an unexpected cardiac arrest in the hospital. Organ retrieval depends on the timing and ischemia control in the patient. So the category 1 dead on arrival patient would have the poorest controlled ischemia and maybe the highest amount of time since the circulatory death. So the tissues procured from them would just be tissues which are heart valves and cornea. In a category 2 patient, since we had seen that they are of 2 types, so when the resuscitation was tried and failed outside the hospital, we'll just be able to procure the kidneys of the donor. And for everything else, which is categories 3, 4, 5 and 2B, we will be able to procure all of the organs except for the heart, as we had just discussed, because this is a case of circulatory death, so we wouldn't be able to retrieve the heart for transplantation from the donor. The only things that you need to know here are what's uncontrolled, what's controlled, the 5 categories that we had discussed, and just that 3 types of organ procurement or tissues can be retrieved from the patient, which are the tissues in dead on arrival, kidneys from a patient who was unsuccessfully tried resuscitation outside the hospital, and everything else we can procure all of the organs except for the heart. That was all. Thank you.